Well, a serious new challenge facing President Obama's health care law, and that portion of it that requires states to set up their own health insurance exchanges. These basically allow the buyers out there who don't have health insurance and need it to compare different types of health insurance plans and then purchase them accordingly. Like I said before the break, it's like an Orbitz, where you go to buy a cheap airline ticket and you can sort of say, this is where I want to go, and then they pump up a bunch of options and you choose the one you want. That's how it's supposed to work. But now as many as 16 state governors say they will not do it. They're not going to come up with their own systems, and they are leaving it to the feds to do so instead, and it may be actually as high as 25 states that are punting it, at least in part, to the feds to do. What are the implications of that? Phil Kerpen is president of American Commitment and author of the book Democracy Denied, and he's been talking to us for a while now about this health care law and some of the potential pitfalls of it that you've been warning about, Phil. So apparently these states say, we're not going to do it, we don't have to do it, and that the feds are going to step in to do it instead. So what's the problem? Why can't the feds just do it?
Well, these things are a lot more complicated than they might sound. There are a tremendous number of different systems they need to interface with, everything from the state Medicaid systems to the IRS systems to figure out eligibility for these new subsidies that are in the new health care law. They're going to run between $10 and $100 million per year in each state to run these. And so these are not simple things. This is not an off-the-shelf software thing. This is a complex bureaucracy. It's going to implement all the new rules and regulations of the federal law, as well as having to be compliant with all of the state regulations in each state. And many of these states looked at all these rules coming out of the feds and they said, guys, you're going to micromanage every aspect of this, but we've got to pay for it. That doesn't make any sense for us. It's your mess. You guys deal with it. And so they're dumping it back on the feds, but they don't really have the money or the manpower to do it. And I think this whole law could unravel as a consequence.
Really?
Well, at least in these states, it remains to be seen if they're going to be able to get these things up and running and if they're going to be effective in any way. And then, Megan, the other aspect of this is there's a legal challenge that Oklahoma has brought, and they argue that the IRS rule that provides subsidies in federally run exchanges is unlawful. And I think they have a very strong argument on that. And so if they prevail, there might not be new Obamacare subsidies in the states that don't set up exchanges.
All right, and just to translate that into real person English, that means that to the extent the Obama administration is subsidizing these health care plans, there's a question about whether that's legal if these health care exchanges are run by the feds as opposed to the states. And now you got 16 to 25 states that are going to have the feds involved in some part. So it raises a new constitutional question behind this law. I want to ask you this. You say that the HHS, Health and Human Services, doesn't have the dough. They don't have the money to set up all these exchanges for these 16-plus states. I read that they were allocated $1 billion to implement the exchanges. Is that enough for 16 states? They have to get it done by January of 14.
Well, the law provided $1 billion in the states to set up state exchanges. It provides zero for these federally run exchanges, and I think that proves that Congress thought all 50 states would be eager to go ahead and do this. Of course, it hasn't turned out that way. And so they've got no specific funding for federally run exchanges. They're trying to reprogram funds from different places. But as more and more of these pile up, and it gets up to 15, 16, maybe 20 or more states, there's a real question whether there's any way they can get this done. Also, the logistical challenge in terms of staffing and actually getting this done makes me very skeptical that they're going to meet the timeline and these things are going to be up and running by 2014. And then really all bets are off, because you're going to be required to buy a plan from an exchange that may or may not exist in your state, and it's unclear how that will be interpreted.
So now what are they going to do? So if HHS has to set up the exchanges in every state, but they don't have the money right now, where do they get the money? And is it from the federal taxpayer?
Well, there are only two possibilities. Either they can try to go to Congress and say, appropriate us funds so that we can do this. I think that's very unlikely to work with Republicans running the House of Representatives. Or they have to somehow reprogram uncommitted funds elsewhere in the government. And there are a couple of contingency funds that are set up in the health care law that they've been trying to use for that purpose so far. But I don't really think there's enough money there to get all of these federal exchanges built for the states. And so if they don't have the money and the sites don't really get built or aren't really working well, I think it's going to be a big challenge for supporters of this law to show that it can be workable.
Because it's both the websites that you'd have to go on, like I've been comparing it to Orbitz or, whatever, Expedia. So it's both the website that will give you the user experience to go on and make your choices, and then sort of the substantive work behind it that will help inform what you're looking at. Wow. All right, Phil. Thank you, sir.
My pleasure.
More on that as we get it.